So the waiting time is for more than 4 hours. It is a busy department. You're calling your next patient from the waiting room. You call, but no reply. What should I do? Just leave it and see the next patient? To be honest, it's a challenging scenario for many of the ED doctor. And it's a common area of questions to assess your situational judgmental skill in SBA exams and in OSCE exams. First of all, I'm Dr. Muhannad Abdul Majid. I'm one of FRCEM Academy course instructor, and today we'll highlight on the management of the absconded patients. So, what does it mean, absconded patient? Absconded patient, that means a patient who has left the ED department unexpectedly without the knowledge of the clinical staffs, and there is a potential risk to their self or to the other. So I'm talking here about patients who lack autonomy or capacity, or there is a potential those patients lack their autonomy. For example, if the patient has some psychotic conditions, if the patient came with suicidal attempt or thought, if the patient was delirious, or if the patient was intoxicated. The personal autonomy, it is the capacity to make a decisions to their self. So what I'm talking here doesn't apply to the patient who are autonomous or who has got capacity and choose, for example, to disengage with a healthcare service. For example, patient came with abdominal pain and you did a blood test and you went again to see the patient and you didn't find. So this patient left the department. This patient chose to disengage with the healthcare service. And there is no reason to believe the patient lacked his or her autonomy. So legally, you are not required to call the patient or to find where the patient is. But it's worth to mention, it's a good practice. If you believe the patient has something bad in their blood or you're concerning an examination, there is a risk of their life or their organ, try to contact the patient and tell them what's going on. If they want to come back, it's okay. If it doesn't want, this is their choice. So, as I mentioned before, it's the absconded patient, especially the patient who lack capacity, it's a challenging scenario in ED setting. So, as a department and as a doctor, what we should do to mitigate the risk of absconded? So, it starts from the patient arrival. So, on arrival, the patient at risk of absconded should go to the mental health triage. Okay, and document the risk assessment for them. Okay. And also, then the triage nurse should do a brief assessment if the patient has a capacity, autonomy, or no. For example, by asking the patient if they understand and engage, if they understand and agree with the initial management plan. So it's not a formal capacity assessment, but it's a brief or initial capacity assessment. So by this kind of assessment, if the patient later on left the department and we didn't do a formal clinical capacity assessment, we can rely on the triage nurse or triage nurse initial assessment to decide what to do at this stage. Also, to mitigate the risk, the nurse at triage, the triage nurse should do a physical descriptions to those patients, and also the triage nurse should inform the patient about the time they need to see a doctor. And if the patient is a high risk of absconding, we should keep observe them continuously or every, for example, 20 minutes, 30 minutes, just to keep an eye on them. Okay. So if the patient keep threatening us, I will leave the department, I want to go, I will not wait to see a doctor, a senior doctor should inform about that. So what that doctor will do, the senior doctor, or if you are a senior doctor, you should do or try to do de-escalations. Try to calm the patient, speak with them. But if you believe the patient is leaving the department and doesn't have a capacity, now you have to consider physical or a chemical restraint. Also, the ED department should have a written agreement with the security team in dealing with this situation. And the last point, remember, we should try avoid or calling the police immediately before doing our risk assessment and our trial to find the patient. Okay, so what we should do if the patient left the department? As I mentioned before, I'm talking about the patient who lacked their capacity and left the department. So we should do searching the ED area. Check the corridor, check the toilet, check around the ED, check the surrounding area. Some patient may went outside just to smoke or have some drink and coming back. You didn't find it. So call or contact the security. They will help you in the search, and also they will check their CCTV. You didn't find the patient, call the patient contact number. If that failed, also consider contact the next of kin. So if you didn't reach to the patients, what should they do? If you are a junior doctor, try to speak with the senior clinicians or the senior nurse. Okay, why we have to speak with them? To do a risk assessment and to check if it was appropriate now to call the police or no. If you are the senior doctor, remember, we are only contacting the police if there is a real and immediate risk to the patient's life. If it was a vulnerable patient, like example, patient with dementia, a patient was a child, okay, or the patient has some learning disability, okay, or all your trials to contact the patient have failed, and there is no other person or service can help to return the patient back to the ED. For example, you have access to the GP and you contact the GP, but you fail. Or the patient was child and you call the parents, but that failed also. Or the next of kin didn't help. Okay. So now at the stage of calling the police, what information we should give it to the police? The police expected from us that we should inform them who you are and who you are looking for and why you want the police to bring that patient back. And the last point, what the step you have taken to find the patient. After informing all this information to the police, please remember, the police don't have a power to return the patient back against their will, unless the patient was under arrest, or the police has been, the patient has been placed under section 136. So the police don't have a power to retain the patient against their will unless the patient under arrest or the patient has been placed under section 136. And remember, if you call the police and you inform the police, you have to do an incident report. If you call the police and you contact them, you should do an incident report. This was my talk for today, and it's worth to mention here, there is amazing MRCEM guidance for absconded patients. You can find it on their website. And finally, I wish a good luck to everyone. Thank you.